What is amplitude in Parkinson's movement therapy? Imagine trying to stretch your arms wide or take a big step forward. In Parkinson's disease, people often struggle with small, hesitant movements. That's where amplitude comes into play. In movement therapy for Parkinson's, amplitude refers to how big or wide a person's movements are during activity. It's about encouraging larger, more expressive motions instead of tiny, restricted ones. This approach helps counteract a common symptom called hypokinesia, which means reduced or very small movements that make everyday tasks harder. One of the most well-known therapies focusing on amplitude is called LSVT BIG. This program is designed specifically for people with Parkinson's. It helps patients relearn what normal movement feels like by training them to move with bigger, more deliberate motions. Often, people with Parkinson's think their movements are normal when they are actually smaller than they should be. LSVT BIG helps recalibrate their perception so they can move more naturally. When patients practice moving bigger, they often find that their movements become faster, smoother, and more fluid. Therapists use exercises that emphasize large, exaggerated movements of the arms, legs, and body. These exercises are repeated many times to help the brain learn new motor patterns. The goal is to improve everyday activities like reaching for objects, standing up from a chair, or walking. Moving with larger amplitude also helps improve posture, flexibility, and balance. When patients are cued to move bigger, they tend to move with more energy and confidence, which can make a real difference in daily life. Practicing amplitude-based exercises regularly helps the brain adapt and form new connections, a process called neuroplasticity. This is important because Parkinson's is a progressive disease, and maintaining mobility is key to independence. Home exercises that reinforce these principles allow patients to keep improving even outside of therapy sessions. The main aim is to help people with Parkinson's live more active, comfortable lives by increasing the size and effectiveness of their movements. In summary, amplitude in Parkinson's movement therapy is about intentionally practicing larger, more forceful movements to fight the tendency towards small, slow motions. It is a core principle in therapies like LSVT BIG and has been shown to improve motor function, balance, and overall quality of life. Always remember, it's important to work with healthcare professionals to develop a personalized plan that fits each individual's needs.